Hello students and friends. Welcome to Homeopathy Medicines. Today in this homeopathic materia medica lesson, I will discuss about homeopathic medicine Ipecacuanha. Before starting this video, please subscribe to this channel for Learn Homeopathy Online Free and Homeopathy Materia Medica. We need support from you to make this channel more beautiful and more informative. Now going to discuss about Ipecacuanha, its uses and symptoms. The chief action is on the ramifications of the pneumogastric nerve, producing spasmodic irritation in chest and stomach. Morphia habit. The principal feature of Ipecacuanha is its persistent nausea and vomiting, which form the chief guiding symptoms. Indicated after indigestible food, raisins, cakes, etc. Especially indicated in fat children and adults, who are feeble and catch cold in relaxing atmosphere, warm, moist weather. Spasmodic affections. Hemorrhage is bright red and profuse. Mind, irritable, holds everything in contempt. Full of desires, for what they know not. Head, bones of skull feel crushed or bruised. Pain extends to teeth and root of tongue. Eyes, inflamed, red. Pain through eyeballs. Profuse lacrimation. Cornea dim. Eyes tire from near vision. State of vision constantly changing. Spasm of accommodation from irritable weakness of the ciliary muscle. Nausea from looking on moving objects. Face, blue rings around eyes. Periodical orbital neuralgia, with lacrimation, photophobia, and smarting eyelids. Nose, coryza, with stoppage of nose and nausea. Epistaxis. Stomach, tongue usually clean. Mouth, moist, much saliva. Constant nausea and vomiting, with pale, twitching of face. Vomits food, bile, blood, mucus. Stomach feels relaxed, as if hanging down. Hiccup. Abdomen, amoebic dysentery with tenesmus, while straining pain so great that it nauseates. Little thirst. Cutting, clutching, worse, around the navel. Body rigid, stretched out stiff. Stools, pitch-like green as grass, like frothy molasses, with griping at navel. Dysenteric, slimy. Female, uterine hemorrhage, profuse, bright, gushing, with nausea. Vomiting during pregnancy. Pain from navel to uterus. Menses too early and too profuse. Respiratory, dyspnea, constant constriction in chest. Asthma. Yearly attacks of difficult shortness of breathing. Continued sneezing, coryza, wheezing cough. Cough incessant and violent, with every breath. Chest seems full of phlegm, but does not yield to coughing. Bubbling rails. Suffocative cough, child becomes stiff, and blue in the face. Whooping cough, with nosebleed, and from mouth. Bleeding from lungs, with nausea, feeling of constriction, rattling cough. Croup. Hemoptysis from slightest exertion, malef. Hoarseness, especially at end of a cold. Complete aphonia. Fever, intermittent fever, irregular cases, after quinine. Slightest chill with much heat, nausea, vomiting, and dyspnea. Relapses from improper diet. Sleep, with eyes half open. Shocks in all limbs on going to sleep. Extremities, body stretched stiff, followed by spasmodic jerking of arms towards each other. Skin, pale, lax. Blue around eyes. Miliary rash. Modalities, worse, periodically, from veal, moist warm wind, lying down. Ipecacuanha has a wide sphere of action among acute sicknesses. Most of its acute complaints commence with nausea, vomiting. The febrile conditions commence with pain in the back between the shoulders, extending down the back, as if it would break, with or without rigors, much fever. Vomiting of bile arid seldom any thirst. This is the general aspect of the beginning of an Ipecacuanha. Fever or gastric trouble or chill and intermittents or bilious attacks. The stomach is disordered. There is a sense of fullness in the stomach, cutting pains in the stomach and below the stomach, going from left to right. The cutting pain and colic goes from left to right. The patient is unable to stir or breathe until the pain passes off. It holds him transfixed in one position, coming like the stabbing of a knife in the region of the stomach, or above the navel. going from left to right, and is attended with prostration and nausea. All the complaints in Ipecac are attended more or less with nausea. Every little pain and distress is attended with nausea. The sufferings seem to center about the stomach, bringing on nausea. There is continuous nausea and gagging. The cough causes nausea and vomiting. It is a dry, hacking, teasing, suffocative cough, accompanied by nausea and vomiting. He coughs until his face grows red, and then there is choking and gagging. With every little gush of blood from any part of the body there is nausea, fainting and sinking. Hence its value in uterine hemorrhages. Bright, red blood with nausea, a little blood is attended with fainting or syncope, but the great overwhelming nausea runs through the complaints of this remedy. Though there is sometimes thirst, it is usually absent. When Ipecac does its best work, there is thirstlessness. With the Ipecac fever, or with the chill, there is likely to be pain in the back of the head, a bruised pain through the head and back of the neck and sometimes down the back, and drawing in the muscles of the back of the neck. A congestive fullness in the head, a crushed feeling in the head and back of the head, the whole head aches and is full of pain. Ipecac is sometimes as restless as arsenic, but the Ipecac prostration comes by spells, whereas the arsenic prostration is continuous. You will see Ipecac patients tossing over the bed as much as they do when they need juice, turning and tossing, and moving the hands and feet, with restlessness. This is especially the case when the spine is somewhat involved. Ipecac has symptoms that look like tetanus, it has opus tetanus, and it has been a useful remedy in cerebrospinal meningitis with vomiting of bile, with pain in the back of the head and neck, and drawing of the muscles of the back, retracting the head. When cerebrospinal meningitis has gone on until the patient is emaciated, when remedies have seemed but to palliate momentarily, and the whole body is inclined backwards, and there is vomiting of everything, even the simplest article taken into the stomach, the tongue is red and dry, and there is constant nausea and vomiting of bile, Ipecac will cure. Ipecac cures inveterate cases of gastritis when even a drop of water will not stay down, everything put in the stomach is vomited, continuous gagging, sharp pain in the stomach, pain in the back, below the shoulder blades, as if it would break, vomiting of bile, continuous nausea and great prostration. Irritable stomach. It also cures when the abdomen is distended, and sensitive, a tympanitic state, when there is vomiting of bile. Ipecac has proved a useful remedy in epidemic dysentery, when the patient is compelled to sit almost constantly upon the stool and passes a little slime, or a little bright red blood, inflammation of the lower portion of the bowel, the rectum and the colon. The tenesmus is awful, burning, and continuous surging with the passage of only a little mucus and blood. With this there is constant nausea, while straining at stool, the pain is so great that nausea comes on, and he vomits bile. At times, whole families are down with it. It runs through a whole valley and may be epidemic, but it commonly relates to endemics. In infants it is indicated when a cholera-like diarrhea has been present and it ends in a dysenteric state, with continued tenesmus, and the expulsion of a little bloody mucus, the child vomiting everything it takes into the stomach, nausea, vomiting, prostration and great pallor. It is also useful in such conditions when the stool is more or less copious, and is green, and the child passes, frequently, copious quantities of green slime. Much crying when at stool, much straining, with passages of green slime, vomiting of green slime, and vomiting of green curds, milk turns green and is vomited. The chest complaints of Ipecac are interesting. Ipecac is especially the infant's friend and is commonly indicated in the bronchitis of infancy. The usual bad cold that ends in chest trouble in infants is a bronchitis. It is very seldom that an infant gets a true pneumonia, it is generally a bronchitis with coarse rattling. The child coughs, gags and suffocates, and there is coarse rattling which can be heard throughout the room, and the trouble has come on pretty rapidly. The child is pale, looks dreadfully sick, and sometimes looks very anxious. The nose is drawn in as if dangerously ill, and the breathing is such as appears in a dangerous case. Ipecac We'll sometimes modify this into a very simple case, break up the cold, and cure the child. In the old books, the pneumonia of infancy had a distinct and separate description, and the typical symptoms were those of Ipecac. You will see a great similarity of symptoms when you study Ipecac and tart together in chest troubles. If you have been studying them together, you will say, how do you distinguish them? They both have rattling cough and breathing, and both have the vomiting. Well, the Ipecac symptoms correspond to the stage of irritation, while the tardiuremetic symptoms appear in the stage of relaxation. That is, the Ipecac symptoms come on hurriedly, come on as the acute symptoms, whereas the tardiuremetic complaints come on slowly. The latter is seldom suited to symptoms that arise within 24 hours, or at least the symptoms of tardiuremetic that arise in 24 hours are not of this class. This group comes on many days later, comes on at the close of a bronchitis when there is threatened paralysis of the lungs, not in the state of irritation, not the dyspnea from irritation, not the suffocation of that sort, but the suffocation from exudation, and from threatened paralysis of the lungs. When the lungs are too weak to expel the mucus, the coarse rattling comes on. Then there is the great exhaustion, deathly pallor of the face and sooty nostrils. We see now that these two remedies do not look alike. If we observe the pace of the two remedies, we see that the complaints differ. It is not so much that they belong to stages, although they do, but rather that Ipecac brings on its symptoms rapidly and effects a crisis speedily, and that tart brings on its symptoms slowly and effects a crisis after many days. You can readily see the value of Ipecac in whooping cough, for it has the paroxysmal character, the red face, and vomiting and gagging with the cough. The red face, thirstlessness, violent whooping, with convulsions, with gagging and vomiting of all that he eats are the symptoms that you will generally find. I have hinted at the hemorrhages, and these open out a great field for Ipecac. I could not practice medicine without Ipecac, because of its importance in hemorrhages. When I say hemorrhages, I do not mean those from cut arteries. I do not mean hemorrhages where surgery must come in. I mean such as uterine hemorrhages, hemorrhages from the kidneys, from the bowels, from the stomach, from the lungs. You must know your remedies in hemorrhages. If you do not, you will be forced to use mechanical means, but the homeopath who is well instructed is able to do without them. In the severest form of uterine hemorrhages, the homeopathic physician is able to do without mechanical means, except when mechanical means are causing the hemorrhage. This does not relate to hourglass contractions. It does not relate to conditions when the afterbirth is retained, or when the uterus has a foreign substance in it, because under such circumstances manipulation is necessary. A distinction must be made. But when we have simply the pure dynamic element to consider, simply and purely a relaxed surface that is bleeding, the remedy is the only thing that will do the work properly. When the uterus is continuously oozing, but every little while the flow increases to a gush, and with every little gush of bright red blood the woman thinks she is going to faint, or there is gasping, and the quantity of the flow is not sufficient to account for such prostration, nausea, syncope, pallor, Ipecac is the remedy. When with the gushing of bright red blood there is an overwhelming fear of death, aconite. If your patient while going through the confinement has had a hot head, an uncontrollable thirst for ice-cold water, and after the confinement, everything has gone on in an orderly way, and the placenta has been delivered, and although you have no reason to expect such hemorrhage it comes on, phosphorus will nearly always be the remedy. In those withered women, lean and slender, who are always suffering from the heat, who want the covers off and want to be cool, who have had a tendency to ooze blood from the uterus, and now have a hemorrhage that is alarming, either with clots, or only an oozing of dark liquid blood, you can hardly do without Secol. A single dose of any one of these medicines on the tongue will check a hemorrhage more quickly than large doses of strong medicine. The hemorrhage will be checked so speedily that in your earlier experiences you will be surprised. You will wonder if it is not possible that it stopped itself. In copious menstruation, Ipecac is often indicated when the woman has taken cold, or has a shock. In cases where she is not especially subject to copious uterine flow at the menstrual period, she is naturally alarmed, for it is something she has never had before, and the flow is likely to continue for many days, attended with this weakness. All her power seems to go with a little gush of blood. Ipecac will cure and end the menstrual flow normally. A fortunate thing in nature is the tendency to check hemorrhage, which is always good. There are a large number of medicines that control hemorrhage, and these you must keep at your fingers' ends. They belong to emergencies. You must know the remedies that correspond to violent symptoms and violent attacks. Ipecac is full of hemorrhage, vomiting of great clots of blood, continuous vomiting of blood in connection with ulceration. In persons who are subject to violent attacks of bleeding, who bleed easily, who have a hemorrhagic tendency, Ipecac will control temporarily the hemorrhage when the symptoms agree. Severe pain in the back in the region of the kidneys, shooting pains, frequent urging to urinate, and the urine contains blood and little clots of blood. The urine is extremely red with blood, which settles to the bottom of the vessel, and lines the whole commode with a layer of blood the thickness of a knife blade. Every pint of urine that it contains will have the coating of blood in the vessel. Every attack of pain in the kidney is attended with that condition of the urine. Ipecacuanha will stop that bleeding. It is true that when patients have bled until they have become anemic, and are subject to dropsy, Ipecac ceases to be the remedy. Its natural follower then is China, which will bring the patient in a position to need an antibiotic remedy. Then there are the colds. Simple, common coryzas among the children. When a cold settles in the nose, and the nose is stuffed up at night, or when the adult has a coryza, with much stuffing up of the nose, blowing of mucus and blood from the nose, much sneezing, and the cold goes farther down and is followed by hoarseness, extending into the trachea with rawness, and finally into the bronchial tubes with suffocation and settling in the chest, think of Ipecac. The Ipecac colds often begin in the nose and spread very rapidly into the chest. With these colds in the nose there is copious bleeding of bright red blood. Every time he takes cold in the nose he has copious bleeding, a tendency to nosebleed with the colds. The inflammation that comes upon the mucous membrane in Ipecac is violent. The irritation comes on suddenly, and the mucous membrane inflames so rapidly that the parts become purple, turgescent, and bleeding seems to be the only natural relief. Stoppage of the nose and loss of smell. The nose becomes so stuffed up that he cannot breathe through it. With the head symptoms, with the colds, with the whooping cough, with the chill, and with many of the inflammatory complaints, the face becomes flushed, bright red, or bluish red, and the lips blue. With the chill the lips and the fingernails are blue. The chill is violent, sometimes congestive in character and often a rigor. The whole frame shakes, and the teeth chatter. There are old incurable cases of asthma that are palliated by Ipecac, and carry around a bottle of it from which they say they get much relief. It is useful in cases of humid asthma, in cases of asthmatic bronchitis, when they suffer from the damp weather and from sudden weather changes. Every little cold rouses up this bronchial attack, and he suffocates and gags when he coughs, or spits up a little blood. He has to sit up nights to breathe, and the attacks are common and frequent. These patients say they get relief from Ipecac, and it is not surprising that Ipecac relieves this style of asthmatic breathing, because it has such symptoms. Some of these cases are incurable, they are people advanced in life. This remedy, more wisely administered, will give more relief. A powder of Ipecac will break up the attack, so that the patient is comfortable, and then will go on in an ordinary sort of asthmatic way, until catching another cold. The cough is rattling and asthmatic. As a convulsive medicine Ipecac is not well enough known. Convulsions in pregnancy. Convulsions in whooping cough, frightful spasms, affecting the whole of the left side, followed by paralysis, clonic and tonic spasms of children and hysterical women. Tetanus, rigidity of the body, with flushed redness of the face. These are strong features of Ipecac, and they have not been sufficiently dwelt upon, and the remedy is not sufficiently known as having these states so prominently. Medicines like belladonna are more frequently spoken of in their books and in treatises of spasms, yet Ipecac is just as important a remedy to be studied in relation to spasms, and its action upon the spine. In suppressed eruptions, the symptoms will very commonly point to Ipecac. When the eruption does not come out, or an eruption has been driven back by cold, sometimes acute manifestations of stomach and bowels follow and colds settle in the chest from suppressed eruptions. Ipecac will also cure erysipelas, when there is the vomiting, the chill, the pain in the back, the thirstlessness and the overwhelming nausea. Ipecac is often sufficient for the nausea and vomiting, when the scarlet fever rash is slow to come out. Instead of the rash coming out as it should, Ipecac symptoms come on in the stomach with nausea and vomiting. Ipecac will check the nausea and vomiting, will bring out the eruption, and the disease will run a milder course. Thanks for watching this video. If you want more videos like Ipecacuanha, please subscribe to this channel and press the bell icon. To learn homeopathy course online free with Homeopathy Materia Medica. Comment us your feedback and what you want in the next video. Like and share this video with your friends and family. For paid and free consultancy online, visit homeopathymedicines.com and mashclinic.com. Thank you. Have a nice day. Stay healthy, stay happy.